Absolutely. COVID-19 virus can actually bind a receptor called the ACE2 receptor on the cells. And whatever the ACE2 receptors are, it'll get in. And one of the most common organs that it can get in, we all know, is it enters the lungs and it causes respiratory failure. That receptor, unfortunately, is not just unique to the lungs. It's actually present in a lot of parts of the body. And more importantly, to us urologists, it's present in the penis as well as in the testis. And so one of our first studies, we actually showed that in guys that had recovered from their COVID infection, that we were able to find the COVID virus inside the testis as well as in the penis. And this was very surprising because after the initial infection and the symptoms had gone away, the virus was still present in these organs. So we went back and asked these guys questions on whether they were having issues with fertility, and we evaluated the sperm parameters, as well as asked them about their erectile function. And surprisingly, not surprising after this finding that we found that the virus was present, we found that the guys who had COVID actually had issues with their sperm count. So at 3 to 6 months after the initial infection, the sperm counts were much lower in about 50 to 60% of men. And thankfully, at about 6 months, some of them guys that had lower sperm counts had recovered. But certainly something important for men to know that if you're trying to conceive and you get COVID, then it's going to be difficult in the next 3 to 6 months at least, especially those that are thinking about undergoing IVF or any assisted reproduction. You just need to be aware that if you do get COVID, that your sperm counts are going to be very low for the next 3 to 6 months. Of note, most important, that concerns a lot more men, is the fact that COVID can cause erectile dysfunction. And some of these can be long-term and permanent because the virus can be present in the cells that supply the blood supply to the penis. And so penis, just like any other organ in the body, just like the heart, just like the lung, it needs to get a lot of blood. And if the blood vessels that supply the penis are affected, men can suffer from erectile dysfunction. We first thought COVID is the pandemic, there's lots of psychological stress and men are seeing their partners all the time. And we thought erectile dysfunction was likely psychological. But after all of these findings, I think we're pretty certain that COVID can cause erectile dysfunction. And so men that do suffer from this issue after their COVID should speak with their doctors about it.